Today, we will be going through myocardial infarction, the definition, pathophysiology, signs and symptoms, causes, complications, diagnosis, treatment, and therapeutic communication. Myocardial infarction, commonly known as heart attack, occurs when there is a blockage of blood flow, most often by a buildup of fat, cholesterol, and other substances, which form a plaque in the arteries that feed the heart, that is the coronary arteries, muscles leading to tissue damage or starvation, because when the tissues, when they do not get oxygen, they will die. The death of tissues leads to the release of troponin and myoglobin. Because of the death of cardiac muscle, the cells die within 45 minutes and the cells are irreversible. Prolonged ischemia causes irreversible damage, infarctions to the heart muscle, the anatomy of the heart. The coronary arteries are responsible for supplying the myocardium, which is the muscular tissue of the heart, with blood. The two main coronary arteries are the left coronary artery and the right coronary artery. The right coronary artery supplies the right ventricle and the right atrium with blood. The left coronary artery further branches into the left anterior descending artery. It supplies the left ventricle, left atrium and septum, and the left circumflex artery. The circumflex means it is around, goes around the heart, which supplies blood to different areas of the heart muscle. The right marginal coronary artery supplies the right ventricle and septum. The septum divides the heart into two equal parts. The posterior descending coronary artery supplies parts of the septum. This coronary arteries ensures that the myocardium receives oxygen, nutrients necessary for its function. The LAD, that is the left anterior descending coronary artery, it is the most common site for blockages. And we all know that the left side of the ventricle, it does much of the pumping. So let's look at the functions of the myocardium. 1. The myocardium is responsible for the contraction of the heart muscle, allowing the heart to pump blood efficiently throughout the body. This contractile function is crucial for maintaining normal blood flow and circulation because all parts of the body needs blood. 2. The myocardium contains specialized cells that conduct electrical impulse to regulate the heart rhythm and coordinate its pumping action. The electrical conduction system ensures that the heart beats in a coordinated and synchronized manner. 3. Support cardiac structure for regulation of blood pressure. Pathophysiology of myocardial infarction. A heart attack occurs when one or more of your coronary arteries become blocked. Over time, a coronary artery can narrow from the buildup of various substances, including cholesterol, arteriosclerosis. This condition, known as coronary artery disease, causes most heart attacks. During a heart attack, one of these plaques can rupture and spill cholesterol and other substances into the bloodstream. A blood clot forms at the site of the ruptures. If large enough, the clot can completely block the flow of blood through the coronary artery. Another cause of a heart attack is a spasm of coronary artery that shuts down blood flow to parts of the heart muscle. Use of tobacco and of illicit drugs such as cocaine can cause a life-threatening spasm of a heart attack and can also occur due to tear in the heart artery, spontaneous coronary artery dissection. Signs and symptoms of coronary artery disease. When the heart muscle doesn't get blood for about 45 minutes, necrosis occurs, and every minute over 500 cells die per minute. So the signs and symptoms. Initially, no signs at the initial stage. the myocyte dies within 6 to 8 hours. The substances the myocytes produce are myoglobin, and it is released 1 hour after post-injury. Troponin level release 2 to 4 post-injury, and this is our main focus, which we'll be talking later in this video. CKMB release 4 to 6 hours. Please, if you are new here, please subscribe, share, like, comment. D changes: ST segment elevation and depression. 10 days after the myocardial infarction, dilation of the injured tissue because of accumulation of collagen, and there will be increase in size or change in size of the heart muscle. So when the patient comes to the hospital, the patient will describe the pain as crashing. C is chest pain, substernal chest pain. R, radiating chest pain. U, unrelieved by nitroglycerin. S, sweating. H, hard to breathe, that is shortness of breath. I, increased heart rate, increased BP or irregular heartbeat. N, nausea and vomiting. G, going to be nervous and scared. Pain of the jaw, pain of the left arm, pain in the mid back or shoulder pain, heartburns, epigastric, pale, cool skin. Risk factors are 1. Age. Men age 45 or older and women age 55 or older are more likely to have a heart attack than young men and women. 2. Tobacco. Smoking and long-term exposure to secondhand smoke increase the risk of a heart attack. 3. High blood pressure. Over time, high blood pressure can damage arteries that feed your heart by accelerating arteriosclerosis. High blood pressure that occurs with obesity, smoking, high cholesterol, or diabetes increases your risk even more. 4. High blood cholesterol or triglyceride level. A high level of low-density lipoproteins, cholesterol, that is bad cholesterol, is more likely to narrow arteries. A high level of triglycerides, a type of blood fat related to your diet, also increase your risk of heart attack. However, a high level of high-density lipoproteins, cholesterol known as good cholesterol, lowers your risk of heart attack. Diabetes. 5. Diabetes. Insulin, a hormone secreted by pancreas, allow your body to use glucose, a form of sugar. Having diabetes, not producing enough insulin or not responding to insulin properly cause your body's blood sugar level to rise. Diabetes, especially uncontrolled, increase your risk of a heart attack. 6. Family history of heart attack. If your siblings, parents, or grandparents have had early heart attacks by age 55 for male relatives and by age 65 for female relatives, you may be at increased risk. 7. Lack of physical exercise. An inactive lifestyle contributes to high cholesterol levels and obesity. People who get regular aerobic exercise have better cardiovascular fitness, which decreases their overall risk of heart attack. Exercise is also beneficial in lowering high blood pressure. 8. Obesity. Obesity is associated with high blood cholesterol levels, high triglyceride level, high blood pressure, and diabetes. Losing just 10% of your body weight can lower the risk of myocardial infarction. 9. Stress. Your response to stress in ways that can increase your risk of heart attack. 9. Illegal drug use. Using stimulant drugs such as cocaine can trigger a spasm of your coronary artery. that can increase a heart attack. 11. A history of preeclampsia. This condition causes high blood pressure during pregnancy and increases the risk after delivery and of lifetime of heart disease. Diabetic patients sometimes have silent MI because they have dead nerves from diabetic neuropathy. Complications: abnormal heart rhythms. If your heart muscle is damaged from a heart attack, electrical short circuits can develop, resulting in abnormal heart rhythms, some of which can be serious, even fatal. 2. Heart failure. The amount of damaged tissue in your heart may be so great that the remaining heart muscle can't do an adequate job of pumping blood out of your heart. Heart failure may be a temporary problem that goes away after your heart, which has been stunned by a heart attack recovery. However, it can also be a chronic condition resulting from exercise and permanent damage to your heart following your heart attack. 3. Heart rupture. Areas of heart muscles weakened by a heart attack can rupture, leaving a hole in part of your heart. This rupture is often fatal. 4. Valve problem. Heart valves damaged during a heart attack may develop severe life-threatening leakage problems. 5. Cardiogenic shock. Diagnosis and tests. Tests will help check if your signs and symptoms, such as chest pain, indicate a heart attack or another condition. These tests include 1. Electrocardiogram (ECG). This first test done to diagnose a heart attack records the electrical activity of your heart via electrodes attached to your skin. Impulses are recorded as waves displayed on a monitor or printed on paper. Because injured heart muscle doesn't conduct electrical impulse, normally the ECG may show that a heart attack has occurred or is in progress. 2. Blood test. Certain heart enzymes slowly leak out into your blood if your heart has been damaged by a heart attack. Emergency room doctor will take sample of your blood to test for the presence of these enzymes, and these are the myoglobin and troponin, but their main focus will be on the troponin. Additional tests: 1. Chest X-ray. An X-ray image of your chest allow your doctor to check the size of your heart and its blood vessels and to look for fluid in your lungs. 2. Echocardiogram. During this test, sound waves directed at your heart from a wand-like device, transducer, held on your chest, bounce off your chest, and are processed electronically to provide video images of your heart. An echocardiogram can help identify whether an area of your heart has been damaged by a heart attack or isn't pumping normally or at peak capacity. 3. Coronary catheterization or angiogram. A liquid dye is injected into the arteries of your heart through a long thin tube catheter that feeds through an artery, usually in your leg or groin, to the arteries in your heart. The dye makes the arteries visible on X-ray, revealing areas of blockage. 4. Exercise stress test. In the days or weeks after your heart attack, you may also undergo a stress test. Stress test measures how your heart and blood vessels respond to exertion. You may walk on a treadmill or pedal a stationary bike while attached to an ECG machine, or you may receive a drug intravenously that stimulates your heart similar to exercise. 5. Your doctor may also order a nuclear stress test, which is similar to exercise stress test, but uses an injected dye and special imaging techniques to produce digital images of your heart while you are exercising. These tests can help determine your long-term treatment. Treatment: aspirin. The emergency operator may instruct you to take aspirin. Aspirin reduces blood clotting, thus helping maintain blood flow through a narrowed artery. 2. Thrombolytics. These drugs, also called clot busters, help dissolve a blood clot that is blocking blood flow to your heart. The earlier you receive a thrombolytic drug after a heart attack, the greater the chance you will survive and with less heart damage. 3. Antiplatelet agents. Emergency room doctor may give you other drugs to help prevent new clots and keep existing clots from getting larger. These include medications such as clopidogrel and other called platelet aggregation inhibitors. 4. Other blood thinning medication. You'll be likely given other medications such as heparin to make your blood less sticky and less likely to form clots. Heparin is given intravenously by an injection under your skin. 5. Pain relievers. You may receive a pain reliever such as morphine to ease your discomfort. 6. Nitroglycerin. These medications used to treat chest pain can help improve blood flow to your heart by widening the blood vessel. 7. Beta blockers. This medication helps relax your heart muscle, slowing your heartbeat and decreases blood pressure, making your heart jobs easier. Beta blockers can limit the amount of heart muscle damage and prevent further heart attacks. 8. ACE inhibitors. These drugs lower blood pressure and reduce stress on the chest. Surgical and other procedures. 1. Coronary angioplasty and stenting. Doctors insert a long thin tube that passes through an artery, usually in your leg or groin, to a blocked artery in your heart. If you had a heart attack, this procedure is often done immediately after a cardiac catheterization, a procedure used to locate blockages. 2. This catheter is equipped with a special balloon that enhances its position in brief inflated to open a blocked coronary artery. A metal mesh stent may be inserted in the coronary artery to keep it open long term, restoring blood flow to the heart. Depending on your condition, your doctor may opt to place a stent coated with a slow releasing medication to help keep your artery open. 2. Coronary artery bypass surgery. In some cases, doctors may perform emergency bypass surgery at the time of a heart attack. If possible, your doctor may suggest that you have bypass surgery after your heart has had time all 3 to 7 days to restore from your heart attack. Bypass surgery involves sewing veins or arteries in place beyond a blocked or narrowed coronary artery, allowing blood flow to the heart to bypass the narrow section. Once blood flow to your heart is restored and your condition is stable, you are likely to remain in the hospital for several days. Education of the patient and therapeutic communication. You educate the patient to deal with emotion, fear, anger, guilt, and depression are all common after a heart attack. Discussing them with your doctor, a family member, or a friend may help, or considering talking to a mental health provider or joining a support group. It's important to mention signs or symptoms of depression to your doctor. Cardiac rehabilitation programs can be effective in preventing or treating depression after a heart attack. Attend cardiac rehabilitations. Many hospitals offer programs that may start while you are in the hospital and, depending on the severity of your attack, continue for a few weeks to months after you return home. Cardiac rehabilitation programs generally focus on four main areas: medication, lifestyle, emotional issues, and a gradual return to your normal activities. Please subscribe to my channel, comment, share, and like. Thanks for